Good morning, good afternoon, good evening. Wherever you are in the diaspora, I want to say Akwaba and welcome to Ghana. I'm Marvin Walker, and you're watching My International Life, Dr. Ankobiah edition. Today on My International Life, we're talking to someone who is not only a specialist, but very special. We're talking to award-winning Dr. Ankobiah of the Bemuah Hospital. Not only has he won awards in the U.S. for his abilities, but also here in Ghana. So we're going to go into the Bemuah facility. We're going to talk to Dr. Ankobiah, and we're going to find out what healthcare benefits and what type of specialists are here and available to you at the Bemuah Royal Hospital, so that when you get and touch down in Ghana, you know, should you have a medical emergency, why this is the place to be. Welcome back to My International Life, Dr. Ankobiah edition. I'm Marvin Walker, your host, and today we will be talking to Dr. William Ankobiah and finding out about his journey back to the continent from the U.S. We'll also be delving into what it's been like setting up his business here, the services that they provide, not only to the diaspora, but the local Ghanaian community, and the impact that it's making in the community. So, Dr. Ankobiah, thank you so much for joining us today.
Thank you, Marvin, for inviting me for this program.
Yes, and I'm so honored that you brought us in here and allowed us to tour your facility. You know, Daycare Health and Transport, we transport several of your patients to this facility and from. And with that, I want to ask you really quick before we get a little bit more information about you. One of our clients we picked up from here, you guys had done an amazing job. And one of my drivers actually made me aware. He said, Mr. Walker, this is the clinic that we picked up Dr. Okansi's mother from, right? And I said, oh, I did not know. So she is one of our clients in Trisaco. Her mother had a stroke, unfortunately, and my home care nurses have been taking care of her. So I want to thank you for the good work that you did, but we picked up from here. So
thank you.
We run in some of the similar circles. Wonderful.
Thank you, Marvin.
So, Dr. William Ankobiah, award-winning, not only in the U.S., I mean, we've done our research, you saw that you won many awards in the States, but then you come back home to Ghana and you're just tearing the place up. You're consulting at all of the facilities, 37, Maritime International. Tell us about William Ankobiah, and so you're Ghanaian born?
Yes, I was born in Ghana, yes, and I went to school and I finished medical school, University of Ghana.
Okay.
And then I spent 4 years in England before I decided to move to the magnet of the world, the United States. So I arrived in the United States in 1984.
84, wow.
And did my residency and fellowship at State University of New York in Brooklyn.
Okay.
And then I practiced. At that time, I didn't have a green card, so I had to go to Kentucky for 2 years to serve the needy area, and that's where I got my citizenship. And actually, whilst I was in Kentucky, I won the Kentucky Govenor Award. So I'm actually a Kentucky Colonel. Every year, the Kentucky Governor awards people who have contributed to the state of Commonwealth of Kentucky.
Oh, wonderful.
So there was a patient who needed a lung transplant, a coal miner, that I facilitated to go to the University of Pittsburgh. It was published in the Louisville Sentinel. And when he heard it, he said, whoa, African here sending the first gold miner to go lung transplant. And that's how I became a Kentucky Govenor.
When you went to the UK, how much time did you spend there?
I spent 3.5 years.
Okay.
I did some training and did some work, but I needed to go to America. So
you needed?
Why, yes.
Oh, why did you need to go to America? What?
Well, you all know that there's more to do and more to present to the world than any other country in the world. So I had to move to go, yes.
Okay. Well, that's interesting, right? So you left Ghana. How old were you when you left Ghana to go to the UK?
So I must have been about 30-ish. Yes.
Okay.
30,
Wonderful.
32, yes.
So in your 30s, you went to the UK. A few years after that, you went to the US. What prompted you to now say, I'm going to leave the US? How many years did you stay in the US?
About 30 years.
30 years.
Yes.
So 30 years of practice, you got your green card, which I'm sure you got your citizenship after that, right? Yeah. Wonderful. So you're an international citizen like myself, right? So you stayed in New York for 30 years. What was your last location?
I was in Queens.
Queens.
I was in Rosedale, Queens. As you know, the Jamaica area in Queens has the largest number of middle-class blacks anywhere in the United States. So my practice, I had a private practice there for 15 years, and I also practiced in three hospitals around doing consult. I also ran a hospital for people on ventilators that needed to be weaned and dialysis and all that. So we did it, but honestly, I got bored. So the reason I decided to come, part of it was boredom, part of it was an adventure. Okay. And I felt, let me go back home. So in 2019, I had finished my house in Ghana, and I decided to buy land in East Legon, which is, Marvin will tell you, it's an upscale place.
Yes, it is. I live in that same community.
1.8 acre land, and then I started building this hospital. So we finished in, I think, 2013. So I came, 2013, I came and opened, and I sold my practice in Queens, and I decided to stay here for 2 years, and it was a challenge. So I've left Ghana for over 30 years. People didn't know me. And being a subspecialist is a challenge in Ghana. Most of the doctors have been trained not to interact with people in cardiology and gastroenterology, and so they are used to general, that in the United States we say internists being in charge, so they feel they can manage everything. So they don't like referring a lung problem to a lung specialist. So I stayed continuously for 2 years, and it was a challenge. I thought I had come home, so I decided that, okay, what I'll do is I'll do locums in the United States. So I started shuttling between the US and Ghana. And the age was creeping up, and it got to a point, I said, boy, you can't continue to do this.
Hi, I'm Dinah Kimball. When I need medical transportation to go to the doctor or the hospital, I use daycare health transportation because they're on time, they're ready, everybody's nice, and they care.
Oh, what age? You're looking young and boyishly handsome still.
So 2018 to 2019, I decided I can't do the locums in the US anymore. So since then, I've been permanently stationed in Ghana and running the hospital.
All right, but that's good stuff. You know, we take a lot of patients to other clinics, and I've met one doctor as well from the US. I think we referred him to Dr. Alfred Gorman. He's a board certified cardiologist. But I had one client that needed to see a specialist like you, and they just didn't know you were here. And she ended up getting on a plane and going back to the US, which is the purpose for this show. We want to help the diasporans like myself who have concerns about, well, will I get the same level of care that I'm used to getting in the US here in Ghana? And tell us what type of services you offer here that they can benefit from at Bemuah.
Okay, so diasporans are not the only ones who feel there's not enough services for them. In part, you can compare U.S. healthcare system to Ghana, so that's no question about it.
Okay.
But in part also, there's so many Ghanaians who have gone to U.S. and returned back to the country that I won't say there is enough, but there are quite a few of us around. So here's the thing. If I practice 30 years in the United States and I come back to Ghana, first of all, any diasporan who comes knows that my level of care, I may not have all the technology that I need, but in terms of analysis, making decisions, how my bedside manners and so on and so forth are at par. And to tell you the truth, I've had a lot of people travel back to Ghana with asthma is our big thing.
Okay.
They've come back to, and recently I saw a nurse from the US who had been struggling with some respiratory problem in the US. I've had patients from Canada who couldn't get to see a specialist. I've had patients from UK who couldn't see a lung specialist. And of course, with all modesty, all doctors are not the same. You have the good, the bad, and the ugly. And it's not country or technology that treats patients, or even a hospital. It's the doctors who treat.
Doctors.
So we have to agree that when you come to Ghana, we're never going to reach the level that will say, I'm so comfortable. Complex procedures, complex things, you still have to go back to the US. But if you have a doctor who understands the US system, has experience in, we can do as much as any other, just like I was doing in Queens for 30 years.
30 years.
We will do that. And if it gets beyond where I can't do it, and there is no technology in Ghana, we will send you back to the US.
You make your
So
okay.
things have changed, I have to tell you, dramatically in Ghana in the last 10 years, because a lot of us have come back. We are teaching young doctors. We're doing, contributing on the faculty of the Ghana College of Physicians, and so on and so forth. I teach at, University of Ghana and 37. So we are making an impact. So we hope not only have things improved, to a level compared to before, but it will continue to improve. So have hope that when you come, I think what Marvin is doing is great, introducing those of us with experience from the US to diasporans who wish to come or who are here, and telling them, look, if you find the right doctor with the right experience from abroad, you will not be far off from the daily grind of care.
Exactly.
And all you need is, if it gets to a level that you need to go, you got to go. But don't pack your bag and go and pay a ticket and do physical in the US, because every year you have to go. That ticket and that thing that can be done here.
Done right
so
here.
Some level of primary care and even some level of specialist care, we can take care of you. And if it gets beyond what it is, yes. If it's a big emergency, maybe. Let's say you have a heart attack immediately, and the heart attacks come different levels. Some people need immediate intervention to have bypass, and it's available, but not as rapid and easy as it should be in the US. So that one I can't vouch that we can do all that.
Yes. So you heard the good doctor. As soon as you have a medical emergency, you don't have to panic, book a $2,400 to $3,000 ticket to head back to the States. There are facilities here with US trained doctors that can help you diagnose and determine whether or not you need to make that move. So that is a very great point. So thank you for sharing that.
Hi, I'm Dinah Kimball. When I need medical transportation to go to the doctor or the hospital, I use daycare health transportation because they're on time, they're ready, everybody's nice, and they care.
What was it like growing the business in the first years? You said it was challenging when you were trying to consult, right? they wouldn't reach out to you because they wanted to manage everything. So then you built the hospital, and did you find it challenging to get patients coming into the facility now that you had your own facility?
Big difference between U.S. business and Ghana businesses. If you want to establish a hospital in the U.S., of course there are certain areas that people will challenge you not to. Across U.S. and the stories, you're going to say a state and a county in the United States, and you say, you are a lung specialist, you're going to establish. And this happened to me in Kentucky. There's a lung specialist there. He feels you are threatening, he will give you a hard time. That is there, and that is in U.S. and Ghana, but not as much in U.S. as in Ghana, number one. Number two is a lot of people in high position can easily feel threatened in Ghana. So that I'm sure Marvin will tell you that they will do things to, there may not be a reason that you are doing equivalent thing, but just you are, stepping on stones and all that. Having said that, there are also areas, I have to say, I've had doctors in Ghana who have challenged and put impediments in. I've also had doctors who have just opened up and glad I'm here. So, for example, 5 years ago, I'm sitting in this office, I hadn't even settled down, I'm doing locums. I got a letter from 37. We've appointed you a consultant at 37 as a lung specialist. Heck, I didn't apply, you didn't interview me. Oh, we're sorry, we need you for a postgraduate program. And we heard about you. You are now a fellow of the Ghana College of Physicians, so you are eligible for your name to be used to teach us.
Wow.
So we're just telling you, come.
We appointed you, come.
So that happens. I mean, even though since I've been there, I've faced challenges with the doctors accepting I'm a subspecialist. So that is there. The key thing to me, and Marvin will even be better to say this than me, is the cultural shock of you understanding how to be. That was not such a big challenge for me, even after 30 years being abroad. I'm still a Ghanaian, and I was traveling back and forth. When I was building this hospital, I used to have brainstorming sessions with nurses and doctors. I was giving lectures at the big hospitals in pulmonary. So I didn't leave. So that's the key thing. Don't pack your bag and suddenly come to Ghana, especially you are from diaspora and say, I'm establishing a business. Give yourself lead time, understand the system, form a network, and so on and so forth.
Yes.
There's still a lot of room for things to be done. Form partnership, particularly if, for example, if you're a doctor in the US, you're an African American, you want to go to motherland to do health, find doctors who have lived in the US and are back here and form relationships to understand how the system works. Because where the big problem is, you come, in your golden armor, I'm going to conquer Ghana, I know what I'm doing is right.
Or you'll get a bunch of chinks in your armor.
That's right. So that is what it is. So I don't think the respect for African Americans is there.
Yeah.
People will give open gates for you. People will listen to you. People will do that. That they may not even give a Ghanaian who is returning home. So that is there. So it just had to be done carefully. And I don't see anyhow how you plan it well, you give yourself time, understand the system, that you can succeed.
You can succeed. Dr. Ankobiah, you're really shedding a lot of light on this healthcare system and how we could come and be a part of it and connect doctors from the U.S. here. But we're going to go pay some bills and we'll come right back to hear some more from you.
Them say life no balance, it be so, but make it no shiver. Nothing the balance pass daycare health and transport. If you know they feel fine, or you dey hear safe ride go someplace, when a medical ride share day for you. We partition on a ride sick of COVID-19. We when a professional nurses fee sort you plus first aid kits for house. Simple cra. You for know the stress. Daycare health and transport be the best. We dey care. When a ref self get wheelchair for inside though. Just in case you know the fee work, we go wheel you boko. Wanna staff day cheap, sake of them be well trained. Where wanna first 2 day low, fala. The same low first you dey pay every day, plus better safeguard. That be why you for ride plus daycare. Make you download the app now from the Google Play Store or the App Store. Daycare, because we care.
We're back from our break, and we're sitting here and we're learning from Dr. William Ankobiah how to get assimilated back into Ghanaian culture, how to make impact, and learning of the great things that he's done to make impact along his 30-plus year journey in the healthcare space. What is next for Bemuah Royal Hospital? Because I hear you guys are extending and building an ICU.
Yes.
Okay.
There are 2 things about this hospital that has to be done. We have the largest asthma clinic in Ghana outside of the big teaching hospital called Kodebu Teaching Hospital. We see about 40 to 50 asthmatics a week. It's a big problem in Ghana. That's number 1. So we do, and we've been recognized, we do that. Number 2 is during the COVID epidemic. When I came back to Ghana, I was tired. I thought I was in semi-retirement. When the COVID hit and people were coming here with COVID at all levels, we got to a point that even though I'm a lung specialist, I hadn't set up an ICU. So I had to send the patients to the other big hospitals when they got bad. And I wasn't happy with the outcome. So a year ago, I decided I have this space, we're going to build an ICU. And we are in the process, and it should be, I'll be in the US this month. When I come back, we're going to open. So those are the 2 things. So we are full-fledged hospital. We do general practice all the way to critical care. There are not any private hospital that can claim that. First of all, there are about 12 ICUs in the country, and most of them are in the big hospitals with a huge number. They are not trained people who can manage ventilators and so on. So that's unique. So we can stabilize you on a vent if you need to be transported to the US until you're ready to go. So that's what is unique about us. There are only about 8 lung specialists in the whole country. And there are only about, maybe let's say 10 people trained in critical care. So our hospital is unique at having somebody experienced in both lung disease and critical care doing this here.
Okay.
So that's what we're doing. We have the reputation. You come to Ghana, you pick up, look on Google Bemuah hospital.com, and you will see everything that we do. We have a lot of technology that you won't find in Ghana. So you come here with chest pain, can do stress test, and all those things are readily available. You have a lung problem, do pulmonary functions, and all that thing. So that is our aim. We've added a lot of things like nerve conduction studies and EEGs, and so on and so forth. We have our own X-ray, we have our own lab. So we have basic stuff that we can immediately make decisions on you within hours, that we know your blood test, X-ray, EKG, everything is done. There are not many hospitals in the country that can claim that. So that's what we offer to people who come.
Okay, wonderful.
And at the moment, we're expanding our staff. We're getting postgraduate doctors to come here. We're going to be a teaching hospital. As soon as we open our ICU, we'll be getting postgraduate doctors rotating. So we are making a move, yes.
All right, wonderful. Well, that's exciting. And part of why we decided to partner with you is because of the number of our patients that wanted to come here. So not only can they Google Bemuah Hospital when they come to Ghana, you can download the Daycare Health and Transport app, and one of our certified transport specialists will pick you up and bring you here because they are our partnered facility, and we trust the care that they get here. because plenty of our patients come here.
Them say life no balance, it be so, but making no shiver. Nothing the balance pass daycare health and transport. If you know they feel fine, or you dey hear safe ride go someplace, when a medical ride share day for you. We partition on a ride sick of COVID-19. We when a professional nurses fee salt you plus first aid kits for house. Simple cra. You for know the stress. Daycare health and transport be the best. We dey care. When a ref self get wheelchair for inside though. Just in case you know the fee walk. We go wheel you boko. When a staff day cheap, sick of them be well trained. Where when a first 2 day low, fala. The same low first you dey pay every day, plus better safeguard. That be why you for ride plus daycare. Make you download the app now from the Google Play Store or the App Store. Daycare, because we care.
Now, when we talk about building a hospital, you hear that's like, you think that that's really cash intensive. Now, I don't want to get into finances, but what I want to talk about is when coming from the diaspora for other healthcare professionals that want to come here and do like you did and set up a hospital. Did you fund this yourself, or were you able to get funding from the U.S.?
Mostly, yes.
Okay.
And mostly my own funding. I had 1 or 2 friends in banks that helped me secure some loan to also help. I didn't get any other funding or investors. But that's Marvin, that you raise a point. I think the feeling that you're coming to Ghana and you want to build a hospital, it's not a bad idea, but the point is to make, for example, in East Legon here, where my land is here, that I bought a bigger land than I needed. And I've used only 1/3 of the land.
Oh, wow.
If you want to build a hospital in East Legon, God bless you, getting a land at a reasonable cost. So, and the land is there, and I'm waiting for people to come in and say, look, we want to partner with you. It's not easy partnering, but the point is, it can always be done legally.
Yes.
And so I think that if somebody wants to fund, there are 2 ways of doing it. You fund the guy with equity, or you can fund the guy with partnership to expand. I have land here that we can expand to do a lot of things. A surgical center, a radiology center, guest house for people coming, and so on and so forth. Right now we're starting a home care school, and we are starting on Monday. And what we're getting are people coming from out of Accra wanting a place to stay. And it's been a challenge. We had to convert some of our on-call rooms to serve a few of them. And it's not the best because hotels and rentals in East Legon are too exorbitant for them. So I think if anyone is listening, is interested, research.
You can locate us at 17 Asoy Crescent, East Legon, Accra, behind MTN office, or send us an email at info@bemuahhospital.com. You can also call us on 0302 543652, 0233
The land here is very costly,
You can visit
but
our
you don't have to
website
come
at
here and spend a lot of your
bemuahhospital.com for more
resources to do
information.
so. You could partner with organizations like his that have been in business for a number of years and know the terrain and can help give you good advice. And you could build complementary services that fit his business, but also generates revenue for your business. So definitely look into that, and we'll be sharing some of that information with you. If you need to get in touch with Dr. Ankobiah because you're thinking about that, make sure to hit us up at info@daycaretransport.com, and we'll connect you with Dr. Ankobiah so that you could bring services and get access to some of this valuable land here in East Legon.
I think since I've been here, I've had numerous questions about, I have Medicare, I'm retired, I'm in Ghana, can I use my Medicare? And I'm surprised most people don't know. When you go to the Medicare website, it will tell you clearly that Medicare only covers the contingent countries: Canada, United States, and Mexico, and Caribbean countries. When you go for a visit for a short period of time, you have an emergency, Medicare will pay. Once you leave the North American environment, even if you go to South America, they won't pay for the service. You got an insurance in Ghana, you don't have to pay anything. There's no even copay in Ghana. So when you get it, you just use it to cover the local services. And then when some big thing happens, maybe you decide you go to the distance. So I thought that point should be made, that you cannot use your Medicare or Medicaid or your Blue Cross or whatever in Ghana unless you upgrade it to an international version.
Well, Dr. Ankobiah, you're a very busy man. You took time out of your day to meet with us. I'm so grateful that you took time to share your insight, your knowledge, and your travels with us, and the way that you're making an impact as a healthcare professional here in Ghana, so that a lot of us feel comfortable coming back home. Guys, you've just watched My International Life, Dr. Ankobiah edition, and you're at Bemuah Royal Hospital in East Legon. The services are here to provide you with the care that you need. So make sure that you look up Bemuah Royal Hospital in East Legon when you get to the continent, and if you have any healthcare concerns, this is the place for you to be. I'm Marvin Walker with My International Life, and we're signing out. Thank you for tuning in. Have a great day.